Hello, my name's Adrian Richards, and today in this video I'm going to be talking about the options available if you feel you have noticed a change and may have a ruptured breast implant. So first thing to sort of mention is that you may have a ruptured breast implant and may not know about it. Nowadays we're using what we call fourth generation silicone breast implants, and these are different from the old first, second and third generations implants in that the shell of them is much thicker, so they're less likely to rupture, and also the silicone that they contain is what we call cohesive, so it's more solid, so it's not so runny essentially. So even if the shell of the implant, the lining of the implant does rupture, the cohesive gel implant is unlikely to run away and cause you any problems. So the first thing is, if you've got a very old implant, there is a possibility that it is ruptured. And sometimes investigations such as ultrasound and even MRI scans aren't that good at picking up whether an implant is ruptured or not. The reason for that is because, as I've discussed in previous videos, the implant and the contained silicone is contained within a breast capsule, and that's lining that the body naturally creates around any foreign body, be it a hip implant or whatever. Okay, so the body walls it off. So even if the implant does rupture, even if it's relatively runny silicone, it's going to be contained within that bag, the body's natural capsule. So you perhaps won't notice any change. Sometimes you can get leaking of the silicone into the tissue, and in that case it will be picked up normally in the lymph glands under the armpit. So in some cases you may notice swelling under the armpit, and if that occurs, you need to get that checked out, because it's what may be called a silicone granuloma, which is where the body, the lymph glands, acts like a sieve picking up foreign material. They pick up any free silicone and they hold it really in that lymph gland, which will enlarge. So if you do develop any lymph glands in your armpit, you really need to get that seen by a specialist plastic surgeon to assess the area. So you may have ruptured implant and may not know about it. You may think you have ruptured implant and they may be intact. If you have a ruptured implant, the breast may appear absolutely normal and have no problems and feel soft like a normal implanted breast. If you do have a ruptured implant, it is relatively easy, straightforward procedure to remove the implant and the gel by your surgeon, clean the whole area out, remove as much silicone as we possibly can, which is most of it, and then insert a new fourth generation implant, which is much stronger and unlikely to cause you any problems. So in summary, if you are concerned that your implant may be ruptured, if you've had some trauma or something's happened to it and you're worried, come and see a plastic surgeon who can arrange for you to have a scan to assess the area. This won't be 100%, but will give us an idea. If you would like more information about what the dangers of having a ruptured implant are, where the silicone can cause you problems, please contact us and we'll send you a free government information leaflet on breast implants, which summarise all the sort of the major studies, all the findings of the big studies on thousands of people who've had breast implants over the years, and look at these sort of things like breast cancer risks and connective tissue arthritis risks. So that summarises all of that. So, but you will find really from that government publication that a ruptured implant won't cause you any problems throughout your body. Well, that's what we doctors call systemic problems. That means through your system, but it may cause problems, as I said, with glands appearing under your arm and changing your breast shape. In summary, if you're concerned about you may have ruptured breast implants, please contact us or another plastic surgeon who will be able to assess the area and recommend the best treatment option for you.